Our understanding of chronic rhinosinusitis is at last beginning to concretize somewhat, and we understand it as an interplay between some genetic factors, a strong component from pathogens, with bacteria playing a role as secondary biologic modifiers to maintain the disease. But more central to this in the past 2 years has been the understanding that the barrier, the lining of the sinus is at cause, and that dysfunctions in the barrier, either offering an environment that allows the colonization with pathogenic bacteria, or by offering holes or a leaky, more permeable epithelium that allow toxins, allergens, and bacteria to penetrate more deeply as part of the problem. And this has important ramifications for therapy.
Well, it depends on the kind of chronic sinusitis. We have chronic sinusitis with and without nasal polyps. I think for chronic sinusitis without polyps, for the typical chronic sinusitis, I think it's the inflammation, and the inflammation can be triggered by infections, but also by allergy or by pollutants or by work-related factors. On the other hand, we see chronic sinusitis with nasal polyps, and there it seems that we have a variation of types of inflammation. We mainly see a type 2 inflammation, which is typically characterized by high IgE levels, eosinophils, and this is related to the presence of Staphylococcus aureus. We have been studying this chronic sinusitis with nasal polyps in Europe and also over the world, and what you see, and that is interesting, is that the type of inflammation is different from where you live. Typically in the Western countries we have the type 2 inflammation with this high eosinophils, high IgE, and IgE to Staphylococcus aureus enterotoxins, and the strong relation to asthma. On the other hand, if you go to China, and especially if you go to the region of Chengdu, there you have a type 1 inflammation. But what is striking, and that is even more important, is that we see that in the region of Beijing, that there the polyps are getting more eosinophilic. And if you go to Japan, there the polyps are quite similar to what we found in Europe. So probably it's not only a genetic factor, it's also the influence of maybe early in life that you have a skewing towards a type 2 inflammation. So it could be that the whole hygiene theory, which skews the inflammation to a type 2 inflammation, also is the basis of the reason why in Europe we have a more type 2 inflammation of chronic sinusitis with nasal polyps.